This week I went to A600, and all the nurses and staff were really nice. And the thing is that you have to be really proactive. You just have to go up and be like, can I follow someone? Can I do something? Can I help you? Because they don't really come up to you and ask you if you want to do something. And they didn't really know what I was allowed to do and what I'm not allowed to do, which is kind of scary because I don't want to do something that I'm not supposed to do because they tell me that I can. So sometimes they'll be like, can you do this for me? Can you do that? And I have to be like, I don't think I can do that. There's a lot of pregnant nurses on that floor, so I got to see where the cafeteria and the break room was, because they would sit in there and eat a lot. But it was a good experience because you get to see what they talk about behind closed doors, and it's usually patients. They just go there to vent mostly. Some interesting things I got to see, well, some nasty things, is the nurse that I was following went and emptied this old man's colostomy bag, which is this little bag that sits on the side of your hip, and your poop goes in there, and so it's just a big bag of poop. So she emptied that into this cup and measured how much was in there and had to chart it. It was really nasty seeing some old man's poop in a jar. But there's this other man who had a penile implant. They said they don't really see that often. I don't think that they would. But he had this little drain coming out of his scrotum to empty fluid. I don't think that sounds very pleasant to have a drain coming out of scrotum. And I got to see all of that business. It was fun. But I also got to see nurses like move and transport patients. We brought a patient up from, I think, the 2nd floor to the 4th floor. It was this cranky old man, but I kind of felt bad for him because he's in a lot of pain and he's really old and didn't really know what he was doing. And then they were moving a patient into a room, and he had a broken leg and he was screaming, and they were trying to move him, and they asked me to like hold his leg while they moved him into another bed, and I was like, I don't know if I can do that. So they got more people in there, and I didn't want to hurt his leg because I don't know. Yeah.
Oh, sorry.
That's okay. And so, yeah, I didn't really want to do that, and I wasn't sure if I was allowed to. So that's pretty much it for my week. It was a lot of fun and very interesting.